The question is debridement for osteoarthritis of the elbow, and what's the data to say that it is effective? That's a very good question. The elbow is the only joint in the human body whereby primary degenerative arthritis of the elbow spares the cartilage. Sounds like a riddle, doesn't it? But it's true, because degenerative arthritis of the elbow is a marginal disease. The most dominant expression of primary elbow arthritis is an osteophyte around the articular margins, including the tip of the olecranon, the coronoid, in both recesses, medial and lateral recesses. If you look at an x-ray, in almost all instances, 70% at least, there's a really good joint space. If you put a scope in, the cartilage isn't that bad, but it's just a lot of osteophytes. So the elbow is unique in the way that it expresses itself. So how do you treat it? In my career of 1,500 total elbows or so, I have replaced 3 or 4 primary degenerative elbows. You don't replace them because the cartilage is still good. You arthroscopically debride them, or if you don't have that ability, you open and debride them. So primary osteoarthritis of the elbow, treatment of choice is debridement. It's a mistake to replace it usually. The data on this started with a Japanese study back in the 80s, and then they followed it up for a 10-year follow-up, showed that there was some recurrence of removing the debris, the osteophytes. Today, most of them are done arthroscopically, and at the international meeting in Argentina in 2 weeks, we've got a symposium on this topic. And one of the talks is, what's the long-term outcome? The answer is, it's good. There's about over time, they will get a recurrence of the osteophytes. The presentation is usually impingement pain. It's not pain through the arc. So if you debride them, you get rid of the impingement pain. And the average age for this is about the mid-50s when you see this, and usually in the dominant arm, not always. And they can go till at least 20 years without having to have another procedure. If you do it arthroscopically, you can repeat the arthroscopic debridement. If the cartilage is worn out, you replace it.